So I'd like to talk about what's happening in Australia with diagnosing FASD. I don't know why this condition has been missed for so long by medical professionals. Some are clearly understand it absolutely and will diagnose, and I'm by no means doctor bashing at all. I'm saying from my experience and the experience of the people who come to me for help and have done over the last 21 years, what seems to be happening is that medical professionals, paediatricians, GPs, psychiatrists, and any profession any profession which can theoretically not theoretically, but actually diagnose FASD. If psychologists can diagnose, they don't seem to be doing that. I understand that it's not an easy process. It's a complicated process. It requires the doctor to refer the patient to a speech therapist, a psychologist, and an occupational therapist to actually obtain the assessments from those people. He needs, or the GP, he or she needs to collate that information, put it together, along with hopefully confirmed prenatal alcohol exposure, make a differential diagnosis, which means that they have to rule everything else out before they make this diagnosis, and then put it on paper. Far too many times I have seen reports which state likely to have FASD. This is from a doctor. Now, it is any parents out there, if you see that on a report from a medical professional, or if somebody says that to you, say, well, why aren't you diagnosing it? Why are you just saying likely to have FASD? Why are you diagnosing autism when I'm telling you that I used alcohol while I was pregnant? I don't understand why this is happening. Birth parents want what's best for their child, and what's best for their child is a proper diagnosis. I know I'm belabouring this point, but that's okay, because this is such an issue in Australia that before I leave this world of FASD, and possibly the next world too, or the life world, I want to make sure I've done everything I possibly can to make people aware that they don't have to put up with GPs, paediatricians, psychiatrists or psychologists saying, I think it's best if an expert deals with this. If you think it's FASD, it needs to go to an expert. There are no experts. You are the experts. You are the people that need to be diagnosing this condition. Actually, it should have been you are the people who should be diagnosing this condition. Sorry, that's one of my pet peeves. Anyway, the more important issue is that you don't let these medical professionals get away with saying, look, I can't diagnose this. They can diagnose. The diagnostic guidelines are on the internet, are available. There are also people who have been diagnosing who are prepared to mentor GPs, paediatricians, psychiatrists and psychologists to make that diagnosis. There is no excuse. And I don't know how many times, how many parents have come to me and said, where do I go to get a diagnosis? I know my child has FASD. I drank. Or alternatively, they've got a report from the birth mum that they drank during pregnancy. And they've said, look, I've been to my paediatrician, they won't diagnose FASD. They said that they'll diagnose autism, but they won't diagnose FASD. It is absolutely, I hesitate to say criminal, but it is, whatever the less impactful word is, it's wrong, it's unethical, it's absurd that people who are making diagnoses, and difficult ones all the time, will not diagnose FASD. This is not something that we as parents should be putting up with. Okay, that's all. I'll leave you, but please don't let them say to you, you need to go somewhere else, because there is nowhere else. There's a clinic on the Gold Coast. There are paediatricians in pockets around Australia who are diagnosing. But if you're an adult who needs a diagnosis, you shouldn't have to try and find someone who's willing to diagnose. Everybody should be able to do that. And if they can't, they should learn how to do it. All right. Okay. Thank you very much.